Hi, we are now going to say about the rounded shoulder. In some cases, the patient's shoulder may be rounded off and comes to the front on both sides. Right? Sometimes we refer to the patient as upper cross syndrome. In upper cross syndrome, the body of the patient, the trunk of the patient will be choked like this. Both the shoulders will come in front like this. They'll be keeping their hands like this, and their neck will be protruded like this. They'll actually be head at the upper cervical region like this. So the neck will be protruded a little bit like this, plus the upper cervical will be hyperextended, plus the thoracic will go for kyphosis. The scapula that will protrude out of this. The scapula will actually come out of its position and protrude out of this, so that the shoulder will come in front. So that the pectoralis major and minor doesn't have any space in front, so it starts to reduce the space occupation. So it becomes tight here in front. Generally, when these patients are attempting to lift their arm sideways, abduction. By means of abduction, patient generally will complain of pain over this area, the superior portion of the shoulder, plus sometimes the movement is not completely fine. Yes, when you do it in the other side, the patient is not able to completely move actually. The reason is when actually the body is in straight position like this, when the spine is in straight position, the trunk is in straight position, the shoulder will be at the back, and pecs will be at the neutral position. Neutral length, the pectoralis major and minor will be in the neutral length, and his shoulder will be at the back and neutral position. At that time, the scapula that will be actually fixed at the real position of the patient at the back. So the scapula will fix actually to the trunk in the normal position. So the false joint we call this scapula-thoracic joint will glide at the thoracic region finely and nicely. But when the patient goes for rounded shoulder, the gliding is affected because neutral position, when the gliding is fine and it is fixed like this, scapula is retracted and it is depressed a little bit to fix in the perfect position. The scapula, when we look at the scapula of the lateral view, it will be from the lateral view, it will be actually forming 30° from the neutral position. 30° from the neutral position, it will be deviated. We call that as normal angle of scapula. So then, when the patient is attempting abduction movement at this angle, not exactly at the neutral position. From this angle, exactly at the angulation of the movement of the scapula, when he is trying to attempt an abduction, we call that movement as scapula. Right? That will be the perfect position. But when the patient is having this stooped position, that means the upper cross syndrome. The trunk is in this stooped position and neck will be stooping in front, protruded in front, and the upper cervical is extended, hyperextended like this. Right? At this time, the scapula will be protruded outward. At that time, when the patient is attempting the actual flexion or abduction movement, the scapula is not exactly in the 30° position. It will be extra, right? The position of the scapula will be little extra. That means not exactly 30. It may be around some 50 or 60. That is exceeded actually, right? Because we are having it in the superior view. This is the neutral position. This is superior view. This is the neutral position. Like this, when you are checking actually, the scapula will not be exactly like this. It will be 30° at the neutral. But when the shoulder is actually rounded, it will be extra, forming extra angle, right? 50° or 60° or 70°, it will be forming extra angle. So at that time, when we attempt to go for abduction movement or any flexion movement or something, when the scapula is in abnormal position, and then the patient is trying to make the movement, the length and strength of the muscle will not meet each other perfectly. Right? The scapula will be already protruded. Within the protruded range, the scapula will come out And along with that, when he is trying to go for moving, making any move, the length and strength of all the muscle components which is present surrounding the shoulder region is not actually correlating with each other. That is the drawback with the shoulder, rounded shoulder. See? Then at this time, when the patient is trying to make some movement, it will cause any abnormal impingement or bleeding or any irritation of the tendon which is present surrounding the joint structure. So that may cause pain. So when the patient is having rounded shoulder, I mean that is out of upper cross syndrome, rounded shoulder. When you try to make any movements or do any actions or day-to-day life activities, the shoulder range will be affected because of pain. So that to retrain him, we have to make postural corrections. To retrain him, thoracic kyphosis, we have to release it, and we have to release the pectoralis major and minor, and we have to strengthen the periscapular muscles on both the sides. Then we have to release the anterior neck muscles. Then posteriorly, the upper cervical muscle. That means the suboccipital muscles. We have to release, and then we have to teach certain exercises for strengthening to make the position correct. So postural correction and scapular stabilization is very much important for reducing the pain in upper cross syndrome. Thank you.